All right, let's wrap this sucker up. There are two emergencies, and only two emergencies, for clavicular fractures that need to go for immediate orthopedic treatment or be sent to the emergency department for an orthopedic surgery consult. The first is tenting. Remember, if a bone is broken and is pressing hard on the skin, you'll get necrosis of the skin, which will then take a closed fracture, which is relatively easy to treat, and make it an open fracture, which would be bad. Finally, neurovascular compromise is the other indication, which is an emergency with a clavicle fracture. Anything other than this are not emergencies. Right? If you take a patient who has a clavicle fracture and send them to the emergency department or ask for a orthopedic emergency consultation, and if it's not tenting and there's not neurovascular compromise, they will make fun of you, and deservedly so. All right, and here are the three big takeaways for clavicle fractures. All right, the first is always document a neurovascular exam, always. Second, make sure you palpate medial to lateral. So here is the sternum. You start at the sternoclavicular joint and the clavicle and the AC joint. The reason is you don't want to miss either one of these injuries, especially a posterior dislocation of the sternoclavicular joint. And you work your way down over here, and then the sort of pitfall, not really a pitfall, but the whole point about it is that you can have a normal x-ray and there'll be no obvious fractures, and you might have an AC disruption or injury and a sternoclavicular disruption or injury, and what will happen is that you will tell the patient that everything's okay because there's no fractures on the film and there's one of these injuries. Don't do that. Palpate, and make sure you tell the patient that a normal bony anatomy on x-ray does not exclude the possibility of a ligamentous injury. Finally, sling. Sling. Do not use figure of eight splints. It's not helpful to patients. It can cause all sorts of issues. Simply place them in a sling, and if somebody with a lot of gray hair, with a lot of initials after their name, wants to put them in a figure of eight splint, then go ahead, but you really shouldn't be the person to do it. Outside of that, thank you for listening. If there's any questions, feel free to ask. As usual, appreciate your time. Thank you. So as a brief addendum, those of you that have been paying attention will notice that there's no AC joint listed after the SC joint, the clavicle, and the AC joint. Yes, I forgot to put it in, and no, I don't know what else to tell you, it's not in. So basically, right, make sure again, right, another take home is that you are going to start medially, go laterally, palpate and document the sternoclavicular joint, the clavicle, and the acromial clavicular joint. Thanks again for watching. Appreciate it. Bye-bye.